Thank you. CEO Miyasato, is there a report today?
Chair Hart and supervisors, I don't have a report myself, but we have asked our experts to come this morning to provide an update to you on the coronavirus COVID-19. So at the table today, we have our public health officer, Dr. Henning Ansorg, Paige Batson, our deputy director and registered nurse, and from Cottage Hospital, Dr. David Fisk, the medical director of infection prevention and control. I also want to acknowledge that Ron Werf, the CEO from Cottage Hospital, and several of his emergency department doctors are here today, and we appreciate them being here. With that, I'm going to hand it over to Public Health.
Thank you, Dr. Ansorg. Ms. Betson, hi.
Hi. Good morning, Chair Hart and members of the board. My name is Paige Batson, and I am the Deputy Director for the Community Health Division. So I want to thank you today for allowing us to be here to share a little bit of what's going on with COVID-19 in California and in Santa Barbara County. As you may be hearing in the news, there's a lot of activity going on with COVID-19. It is indeed evolving rapidly. Ever since we learned of it beginning in Wuhan, China, there's just been a lot of activities. And so you'll be hearing later on in my presentation that the numbers in terms of confirmed cases and so forth are changing by the hour. Guidance to local health departments on what we need to do to help mitigate or prevent the disease from spreading, and guidance for our public health department is coming pretty steadily from CDC and CDPH. And so a little bit of background in terms of the spread of the disease. First of all, let me begin. In Santa Barbara County, there are 0 cases. So we have no cases, and we currently have no individuals that are what we call persons under investigation. So that is really good news. And as we began to see cases evolving in, or being identified in the U.S. Declared a public health emergency. And as we began to see cases in California, Governor Newsom declared a state of emergency for California. And so, as you also may know, that there are other countries where travel is at a level 3 travel advisory. We have Iran, Italy, South Korea, Hong Kong, and Japan. And so that's an indication of the spread of the virus. Of importance is a recent activity that occurred on March 5th. The Department of Managed Healthcare directed full-service commercial plans and Medi-Cal plans to assure that their beneficiaries have zero cost sharing. And this is really a good thing because it allows for individuals not to concern themselves with deductibles, cost sharing, and so forth. It allows them to seek whatever medical services they need and be able to access screening and testing and any COVID-19 related medical expenses to be covered at no expense to them. And so for public health, this is important because it allows us to identify cases much earlier, and it allows those individuals that do worry about costs to get in early and seek the screening. Additionally, on March 8th, we finally received some updated guidance for schools, colleges, and for large mass gatherings. This is long awaited in that it provided much more specific information about the importance of what kinds of plans schools need, what kinds of plans schools need to have in place, and what they would need to do with regard to social distancing. A lot of that would be in consult with the health officer as it relates to what else is going on in the community. But there's a lot more specificity in those guidance, and Dr. Onsor will be speaking to that a little later. Okay, so as of yesterday morning, mid-morning, we had 423 cases in the U.S., and in California, we had 133 confirmed cases. I'm here to tell you that as of this morning, as of this morning, we have 133 cases. We have 24 that were repatriated. We have 44 that are travel related, 28 person to person, and 19 with community transmission, and 18 that are under investigation. I will tell you that these numbers, by the time I walk out of this room, they will have changed. And there's only one death in California. So what's happening specifically here in Santa Barbara County? We continue to receive direct notification from the California Department of Public Health of travelers coming from mainland China. It's an automatic electronic process, and upon learning that the traveler has arrived in Santa Barbara County, we initiate a 14-day public health supervised monitoring process. And so, additionally, the CDC has broadened its testing criteria for what we call a person under investigation. In the past, that PUI, public person under investigation, was very limited. It was limited primarily to individuals who had traveled, who had been exposed to a confirmed case, and so forth. Now it is broadened so that medical providers can use their own clinical judgment to determine whether testing is indicated. And so it now allows for us to look at seniors greater than 65 years of age and to test them, as well as individuals with comorbidities or chronic medical conditions like heart and lung disease. So this is really important for us as we know, it's the COVID-19 is hitting our elderly a little bit harder. Additionally, we now have 17 testing sites in the U.S., and we are really proud to say that it now includes LabCorp and Quest. So we're really excited about that. That is a little bit overdue, but we have it now. So as far as local monitoring from the Public Health Department, we have a total of 45 individuals that we've monitored. 20 have cleared their monitoring, meaning that the 14 days have passed and there were no symptoms and no further action was required. We currently have 5 being monitored and 18 that either their destination was not Santa Barbara or that who self-reported, and we learned that there was actually no travel history at that time. We have 3 others that we are pending contact, and I learned as of this morning there's only 1 left that we need to reach out to. So things are going really well in terms of our monitoring process. Our monitoring process is pretty solid, and we anticipate that we have a little bit more capacity for monitoring should that be necessary. I also want to share that our Public Health Department DOC was activated on March 6th, and we are open from 9 to 12, and it's primarily to provide our medical health community with resources that may be needed, whether that be masks, whether that be ventilators, and so forth. And so with that, I will turn it over to Dr. Onsarg.
Thank you, Paige. Esteemed Board of Supervisors, Mr. Chairman, I just want to assure you that myself and our very dedicated team from Public Health, we are taking this situation seriously. And I want to reassure you that we are well prepared. We are trained for this. And we have been in the line of fire, pun intended, on several occasions. And we have proven that we can step up to the plate if necessary. The role of the Public Health Department in restricting or limiting, liberties in order to prevent public health has to be taken with a lot of caution and reason. And I would like to stress that depending on the level of community transmission, those recommendations or orders would, depend on how many diseased individuals we have in our community. So as of right now, since we do not have a single case in Santa Barbara County, only 1 case that was travel-related in our southern neighboring Ventura County, and no cases in San Luis Obispo County, we feel comfortable to just be on alert, and we are. And we could change this alert level in a matter of minutes and declare local health emergency, but so far we haven't we haven't thought that we need to do this. But rest assured, we are ready. So we are working very closely with our partners at the CDC, at CDPH, and also with the Southern Californian health officers, as well as with our really supportive local community physicians. Dr. Fisk is here to my left, and he will speak later as the Director of Infection Control for Cottage Health System. We are also in contact, obviously, with the Northern County hospitals, and in very close communication. Once we will have a confirmed case in the county, our level of alertness will ramp up, and we are actually already sending out messages that we do recommend social distancing for vulnerable individuals. The vast majority of people who come down with this viral illness fortunately have a mild course of the disease and recover really well without any hospital care or anything. However, about 20%, those are the numbers that we extrapolate from China, are likely to need more intensive hospital care at times, or even intensive care and respiratory support in an intensive care unit. Cases that have died are almost always elderly folks or people with a weakened immune system due to chronic illnesses, or people who have to take certain medications to reduce their immunity, like transplant recipients or people with severe diseases that require immunosuppression. Those people are advised to really think twice about going to a movie theater or a concert or attend a conference, even at this time, because travel is really everywhere, and people come from everywhere and travel, especially to events of that nature. We have worked with our local schools, K-12, as well as institutions of higher education, and they have all been very eager and compliant and helpful with issuing very robust endemic preparedness programs. They are all really ramping up their regular cleaning and disinfection. They make sure that no sick individuals attend school, neither students nor staff. This is really essential. Everybody in the community was very concerned about the cruise ships that do dock at Santa Barbara Harbor, and we do not take this lightly. Obviously, the cruise ships are under direct supervision by the CDC as their public health agency, and they are also under orders by the Coast Guard, and in our case by the captain of the port in Los Angeles, who is actually in charge of quarantining a ship if needed. We understand that there is an understandable sentiment in the community that would like cruise ships to be banned. You may have heard that the next scheduled cruise ship has canceled. That would have arrived here on March 24th. So we are working very closely with the federal government, and you will remember that Vice President Pence has been in very intense discussions with the cruise lines over the weekend already. And the state, because we have so many ports in California, is on this. And we are waiting for, we want to be in line with the cooperation with the state so that we have a concerted effort, and we do not vary too much with them. But we should have much clearer guidance in the very near future. With respect to the waterfront area, The city is actually the custodian of the real estate there, and they would also have authority to weigh in. I will attend the city council meeting later today, and we will discuss that further at that venue. With this, I would like to pass on. You want some else? Hand washing? We can't wash our hands enough, obviously. So because this virus is one of many, a whole bunch of viruses that causes upper respiratory infections, and it's transmitted via an aerosol, which means basically saliva that is, expelled via sneezing and coughing and so forth. It is very important to protect ourselves. We have to just ramp up our hygiene measures. We have to remind ourselves not to shake hands so much at this time, and do the elbow or fist bump instead. And my colleagues earlier reminded me very kindly when I try to shake somebody's hand. And I know how hard it is, because it's a formal greeting, and but in this time we encourage you to please refrain from that. Also, please stay at home when you're sick, and don't send your kids to school when they're sick. Let them recover. I'm not talking about Covid-19 sick, but generally sick, because it is impossible to differentiate a common cold from influenza, from Covid-19, adenovirus, or other coronaviruses, or RSV viruses that are all in our community and causing the same symptoms. And the art of medicine is in part to determine with tests and experience and investigation which is the most likely cause of this illness. But a lot of questions come up with regard to wearing masks. There are two very clear scenarios where masks are very helpful, and it's been proven scientifically that if a sick person wears a surgical mask, that when they have to cough or sneeze or something, about 50% of those excretions are actually captured in the mask, and therefore less viruses are spread. So it is helpful, and all our outpatient clinics and hospitals have signage on the outside and ask people if they have a cough, and if they do, they will put on a surgical mask right then and there before they even get to the either into the door or to the counter. And that is really important. The other mask that is available is a so-called N95 respirator. And everybody in California knows these, because we use them in the fire to get, reduced particle inhalation from the smoke. But those respirators are actually designed for people who work in the healthcare setting with infectious individuals, for instance, tuberculosis or any other respiratory contagious illness, and they should remain reserved for those people. We see on TV frequently that people run around with masks, mainly in Asian countries, which is a cultural issue. Also, the density of the population is so much higher, and public transport usage is so much higher than in our area, that it's understandable that people want to wear masks. As long as you cannot stay away at arm's length from other people, you're actually at risk of getting infected. But in our area, it's not recommended. There is no scientific proof that it will prevent you from catching an infection that is actually only transmitted via respiratory secretions. So our community preparation efforts are in full gear. Our emergency response team has solidified their reserves in masks and materials to protect healthcare workers, and working closely with the ambulances, emergency rooms, and so forth. And with this, I would like to introduce you to Dr. Fisk, who is Medical Director of Cottage Infection Control.
Welcome, Dr. Fisk. Thank you for being here, and thank you, Dr. Ansberg, for that presentation.
Good morning,
That was
everyone.
awesome.
Can you hear me?
Yes.
Yep. Good morning, Mr. Supervisor, and thanks for having us today. I would just start my comments by saying Cottage as an institution, similar to our colleagues in public health, have dealt with situations analogous to COVID-19 in the past. And if you think back to the Ebola episodes when we had Ebola cases entering the United States, Cottage rapidly ramped up its capacity to care for patients with highly communicable diseases like that. And we have built extensively on that experience rapidly since the first cases of COVID-19 were announced in December. And I would say at this point, I feel that Cottage is ready to manage patients on the inpatient side with COVID-19. And let me walk you through some of our preparations as an organization. And I also would say that I'm here today with our ER lead, Dr. Brett Wilson, and our CEO, Ron Werft, who are also available for questions on behalf of Cottage. The focus at Cottage has really come from morning meetings we're holding every day that are multidisciplinary, and they last between an hour and 2 hours, and involve people that you would expect to be there, but maybe people you would not expect at first glance to be there. So it involves hospital leadership, medical staff leadership, it involves public relations, it involves ER staff, it involves facilities management people, it involves people involved in our supply chain and ensuring we have access to supplies, not only supplies such as N95 masks that are directly used in the care of COVID patients, but also supplies for our routine processes such as surgical implants that might be compromised by the supply chain disruptions from Asia. Furthermore, we have our transfer center involved in these meetings so that we can appropriately screen patients who are going to be transferred from other hospitals to Cottage so that we know if they have any symptoms that could be similar to COVID or if they have any risk factors for exposure to COVID. Our meetings also involve our infection control personnel with their expertise and many others. And so it's a meeting, I would say, probably of about 30 individuals from throughout the organization, plus or minus on a daily basis. So there's very, very detailed effort to this that's permeating the organization. And I would just say that our efforts are really looking with the goals of being able to care for our community, but also a goal on the hospital side of being able to protect our staff from COVID-19, from inadvertent exposures to COVID-19. Because if now there is an exposure of a medical person, the standard recommendation has been that they are then off work for 14 days. And as you can see, that happened, for example, in Northern California with exposures in hospitals there. One patient came in and 150 staff members had to be furloughed from Northern California Hospital. So we are putting extensive effort into identifying potential COVID patients, not at the door, but before they get to the door, out in the parking lot, over the phone, before they come onto Cottage premises. So if any of you have been to Cottage lately, you'll see signage outside our public entrances. You'll see security personnel also in various locations like the ER to help if people who have suspect symptoms need to be immediately masked before they enter the building. Because from a healthcare standpoint, if a potential source patient is masked before they enter the facility, then the exposure level to the healthcare providers and other patients, for example, in the ER waiting room, goes down dramatically. So that helps protect all of us. So that's a theme of our efforts. And in addition to that, really we are working on educating our staff throughout the organization, all the way from physicians in our critical care unit to people involved in patient transport because their risk of exposure and they're critical to the function of our hospital as well. And we're also working on communication, and our lines of communication with Dr. Ansorg and our colleagues at Public Health have been wide open, and he and I are on the phone are regularly throughout the day and night lately. Also, the ER has taken a very amazing role at helping to educate its staff so they know how to care for a suspect patient on the way in the door, but also reaching out to take the lead in helping shape the communication from Cottage to educating our community and educating our colleagues throughout the hospital based on their extensive experience at managing patients with highly infectious conditions. In terms of communication as well, we're communicating very closely with SANSOM, where I'm employed, and with the leadership of that organization, and UCSB as well, and the county clinics. So that's a key thing, that we do have a unified approach throughout our community for how patients with COVID are managed, whether they're in the outpatient setting, whether they're in an ambulatory health clinic, or whether they're on the inpatient side. We need to have a standard approach, and we're all striving for that. And I know more meetings are scheduled to actually just achieve that and really into the level of perfection that we would like. We also have a key role in this outbreak, I think, to anticipate what is going on. And we need to be very adaptive quickly. As I know Paige just mentioned, things literally change by the hour. And so how we are handling potential and suspect patients and our outreach and partnering with our community organizations changes very regularly. Examples being at Cottage, we went ahead and decided to consider individuals coming into Cottage with symptoms of COVID and symptoms of severe COVID as suspect patients for this, even though they may not have had a travel history. We decided to do that before the CDC sort of officially announced that that was one of their criteria, because we realized that this was likely circulating in the United States already at that point. And again, our goal being to achieve early diagnosis, early detection, and getting patients who may have this virus into negative pressure rooms and isolation so they can't spread it and make others sick. So the guidance from the CDC has been fabulous, but it does take time. And sometimes we even want to be more adaptive than at times than the guidance from the federal government, because that takes a little time in the face of a rapidly changing epidemic and scenario like we're dealing with. So adaptation is key. In terms of supplies at Cottage, let me just touch on a few of these. This is an issue I know that's been in the news a lot in terms of how many, what's the supply of personal protective equipment, the gowns, the gloves, the goggles, and the N95 mask that Dr. Ansorg mentioned a moment ago. Cottage has had a good supply of N95 masks, but we are very, very protective of those masks at this point, because we realize there are national and international shortages of these and supply chain disruptions that are looming. And so we have instituted processes for keeping close tabs on those masks so that we have them available to our staff to protect themselves, so they don't then get sick and then have to be off of work and not be able to do their duties as healthcare providers. Other supplies, we had identified some potential shortages at a time of our regular exam gloves, size medium, from supply chain disruptions. And so that's the level of granular detail that we are looking at Cottage to try to stay prepared for this. That supply has since improved since we initially identified that shortage, but I know there's daily monitoring and updates to our working group on our supply status every day. We have a good, you might have heard of these so-called PAPRs, which are the powered air purifying respirators. The face masks with the little battery pack that blow air in a positive pressure fashion, which are different from the N95. Those are what are needed when procedures such as intubating a patient or performing procedures on the respiratory tract are done. those involved in those need to wear these masks for protection during that time. And Cottage is well supplied with those, and we actually just obtained many more of those as well. So we have a good resource of those. Due to the new construction at Cottage, if this situation gets really, really bad, Cottage is fortunate that we have 47 negative pressure rooms throughout our organization, meaning rooms that are ready to go at this moment to handle and treat patients with COVID-19. And that is much more in terms of a percentage of beds than most institutions have available to them. So we're very, very pleased with that. We also do have surge capacity for potential opening of other dedicated unit for COVID-19 patients if things get really desperate. So I do feel we are well positioned to handle occasional cases that we could be dealing with, or even a much larger number of cases if that were the case to happen. Now, we have had patients who have met so-called PUI criteria, people under investigation or persons under investigation, who have come through our system and have been ruled out as having COVID-19. And we work very closely with our public health colleagues on each and every one of those. But I think it's actually been useful in a sense from an organization standpoint to have had the luxury of having patients who tested negative, but also to sort of test our processes and refine our processes based on those experiences. So our staff has gained experience at, treating someone as if they potentially had COVID-19, and I think are confident in their ability to manage more patients should we get more people under investigation or people who have actual disease. But I would emphasize again, as Dr. Ansorg mentioned, that we have not had any confirmed cases of COVID-19 at Cottage. And with that, I'll stop.
Thank you very much, Dr. Fisk. That is very reassuring to the public and to us to know the very close collaboration between County Public Health and Cottage Hospital and all the resources and daily contact and planning that you're doing. Appreciate specifically Mr. Werft and Dr. Wilson and Dr. Potowski, who are all here too from Cottage Hospital to answer any questions. I know board members do have questions. So with that, let's start with Supervisor Hartman.
Thank you. So if I understand, the cold, the flu, upper respiratory infection is indistinguishable from the COVID virus. So if you have that, you should stay home. And when it gets serious, is there any distinguishing way to know that it is, or you actually have to be tested?
Yeah, thank you very much for that question, Supervisor. I would offer that the common cold is an upper respiratory infection. COVID-19 can be an upper respiratory infection, but actually it can be a lower respiratory infection also. So it is more able to be distinguished when it becomes a lower respiratory infection, i.e. infects the lungs itself and not your back of your throat. Namely, because people are sicker, they may require supplemental oxygen to breathe, and they're going to have abnormalities on imaging, chest x-rays, CAT scans, and the like. So when someone has COVID-19 that is in the phase where it may just be an upper respiratory infection, it truly is indistinguishable from the common cold. But once it becomes a lower respiratory tract infection, there are some distinguishing clues that we can pick up even in the absence of the ability of having a test. The problem is that once it moves into the lungs, then you have pneumonia. And as you know, there are dozens and dozens and dozens of causes of pneumonia, and you can't look at an x-ray and tell that this is a cause from COVID versus this is a cause from influenza that moved into the lungs or more common bacterial pneumonia. So testing is key to helping us distinguish the actual cause, but the clinical symptoms that someone presents with are very common that we're seeing on a daily basis throughout healthcare around the world. So therein lies some of the inherent challenges of this virus.
So I have a few more questions. So you're at home and you suspect maybe you have it. What should you do? I mean,
And also, Dr. Ansari, I want him to feel free to chime in his role too. But as an infectious disease physician, I'll answer that question. If you're at home and you have the common cold, you should stay at home and treat your symptoms. And if that common cold actually happens to be caused by COVID-19, you should stay at home and treat your symptoms. When you should seek medical attention for it is if you have shortness of breath, pain with breathing, or unrelenting fevers over a period of days. Those are really some of the warning signs that more serious disease, potentially moving into the lower respiratory tract, have arisen. But I think your point is well taken, that there is a very essential role for those who are sick now to stay home. And that's something we struggle with as healthcare providers too. We don't like to stay home, but we need to stay home when we're sick too. And in a time like this, where we're trying to protect our most vulnerable, particularly the elderly, those in nursing facilities, extended care facilities, and those with weakened immune systems, it's all the more important that those of us who are sick but feel well enough to go out of the house think twice and actually stay at home.
And another question, and this has come into my office. We know it's not here in Santa Barbara County because if it had been, it would be spreading outward. So if somebody was sick and recovered, or was sick and died from something, we know that wasn't this virus, because otherwise we would have had it spread, right?
Well, actually, my personal opinion is that it is in Santa Barbara County, but we just haven't had someone sick enough with it to achieve a need to be tested and diagnosed. My suspicion personally is it's been here for over a month. And in a way, I find that reassuring that we're not seeing a huge surge in people presenting to Dr. Wilson in the emergency department with critical respiratory disease or respiratory failure who need to come into intensive care. And the reasons I feel it's likely circulating, even though we haven't had testing, are simply because we live in a global society and this virus has spread globally in the matter of weeks. Santa Barbara has a lot of international travel, and we go places, and we have a lot of people who have weakened immune systems and are at risk for this. So that's just a theory. I have no proof of that, but it is something that I think many of my colleagues in the world of infectious diseases share that opinion, that it's likely here. It's just in such a state that it is not causing severe enough disease that it has yet warranted testing.
And just two more questions, if I may. Again, someone's home, they're sick, they suspect they may have it. We don't want them just to go to the emergency room or urgent care. What would you do if they, what do you recommend that they do?
Yes, thank you. One of our big efforts has been, if people think they're going to need to come in to be evaluated in the emergency department for this, that they call ahead. A big effort from our marketing and communications team and from our ER and throughout Cottage has been to try to get the word out, and also from SANSOM, that we would prefer that you not just show up at the door, because that way we can be prepared to receive you if you think you need to come in for care, but receive you in a way that we can then protect other patients in case you have this, and also protect our staff. So we ask people, if they do plan to seek medical care at a medical office or at the emergency department, to contact the place they're going ahead of time. And those numbers are posted on our signage and on the communications that have gone out from Cottage and on the Cottage website as well.
And then I'll get my last question and make it actually two. The contagion period, if you have it, or you've had a cold or flu or something, is it 2 weeks from the start or 2 weeks from the end? And then my final question is, can you talk about the arc of what we would expect to see over the next several weeks or months?
Thank you. The average incubation period of this virus, from what we've learned from the Chinese experience, has been about 4 to 6 days. So that's the time frame from exposure to onset of symptoms, 4 to 6 days. I emphasize that that's an average. I don't think we know yet the outer limit of the period where someone can transmit this virus. It's felt that the majority of people no longer transmit it after 2 weeks, but as we know from other viruses in this family, and similar experience and occasional cases that we're hearing from other countries, there may be shedding of this virus from an infected individual for significantly longer than 14 days. How long, we really don't know. And I think the more time we have to learn about how people who have weakened immune systems manage this virus, that will really be the group that is most at risk for shedding this the longest. As to your second question, in terms of what to expect from this, and I welcome all my colleagues' input as well, because this is just one opinion, but my personal opinion is that we will see cases of this in Santa Barbara County. We will see the vast majority of cases in people who do not need hospitalization. We may end up needing to have some who do require hospital care for this, and that this process will go on probably for at least another 2 months. But beyond that, I really wouldn't want to hazard a guess. I really think the unknown is there potential for there to be a huge upsurge in those who are critically ill from this, requiring hospitalization and supplemental oxygen and things. I think that's, I would say, unlikely for that to happen here, but not 0% possibility of that.
Thank you, Dr. Fisk. Supervisor Williams.
So I just want a little bit more precision on the symptoms. You know, just as a father of young kids, there's almost no day that they don't exhibit some runny nose. So it's like, are we gonna? So I just want a little more precision. Are we talking about keeping everyone home with a runny nose, or keeping people that exhibit a cough and temperature, or a cough or temperature? And because there are temperature variations, how much of a temperature variation?
Yeah, we've learned that temperature is not a prerequisite to have COVID-19. It was around 45% of the patients in a recent New England Journal of Medicine report out of China were found to have fever when they were diagnosed with COVID-19. So whereas we first thought that fever was a critical and essential symptom to be considered COVID-19, we know that's no longer the case. So, really anyone who has a significant cough and runny nose, sore throat, those are patients who do have the potential of having COVID. The more severe the symptoms, the greater the likelihood of that, I think. But certainly the symptoms that we are on highest alert for are indeed pain with breathing and shortness of breath for those who also have a cough, and a general sense of weakness and fatigue and body aches as well. There's a relatively small number of individuals who have diarrhea as one of their symptoms of COVID-19, but that is not something we're asking, necessarily to be at the top of our list for identification. It's primarily respiratory symptoms.
So I'm sorry, I'm going to be really precise and try to repeat it to you based on your answer to John's question, but I just really think this is important to get out to the public because, if we don't know, likelihood is most people in the public don't know. So you should stay home if there is a cough or a temperature or a severe runny nose or body aches.
Or problems with breathing, difficulty in breathing.
Well, and then you should contact a doctor if there is pain breathing, shortness of breath, and a long fever over multiple days.
I think if you have any questions about your health, we encourage people to contact their doctor, because we cannot give standard answers for all symptoms, and it's very important to know someone's risk profile too. The risk profile of someone who's 80 years old and has pre-existing lung disease for doing poorly from COVID-19 is very different from the risk profile of a healthy 18-year-old. But in terms of symptoms and guidance to stay home, as with any common cold, we would encourage people to stay home because of the high potential for transferring that and the high communicability of that. Same with influenza, which is circulating in our community and actually killing tens of thousands of Americans right now. We don't want people moving around and they have that, and the hallmark of that is fever and body aches as well. So we don't limit our guidance on staying home to symptoms necessarily from COVID. We want to include all of the communicable respiratory illnesses in that. So there is some variation in symptom from group to group and person to person, but the common themes are, yes, cough, sore throat, body aches, plus or minus fever, and runny noses as well. Now, children, though, have been relatively spared this infection. And children, I was just on a call with the state health department this morning, and again, everyone was emphasizing how children, although they don't seem to be getting sick with this, we truly do not know if they can transmit it. And we know from other viruses that children can have no symptoms yet transmit the virus, just like many adults can. So we suspect that children may be vectors of this and able to transfer it without actually manifesting symptoms, but that has not been proven.
And then one of my previous questions was how many testing kits we have ready, but one of the questions that my thought was, or at least my impression was, that's no longer all that relevant of a question because of how rapid testing is with various testing spots. Is that the case, Dr. Answer?
Well, not quite, because this test was just approved by the FDA and is quite labor intensive. You know, we have these rapid tests for influenza, for instance, or strep throat and things like that. They're like a pregnancy test, pretty much. They take 5 minutes and you have the result, plus or minus. And in the near future, but probably not this season, this will be available as well. But for right now, it is, you know, a culture from the pharynx, and it has to be, you know, transported to the lab, and it's labor intensive. So the turnaround time for the commercial labs is probably 3-4 days at the moment. But they just rolled it out yesterday, so we have to cut them a little bit of slack, just a little bit. And public health labs are much faster right now, because they were able to, require a lot of test kits, and the turnaround time is like often the same day or 24 hours, which is great. And we like to reserve the fast testing capability for our really vulnerable populations, like the nursing home, where we need to get a handle on an outbreak that we are anticipating or that we are being afraid of, so that we have fast results for those really critical situations. Or for instance, for healthcare workers or an outbreak at cottage, that would be a nightmare, you know, if all the nurses get sick. Who's taking care of the patients? And so we want to reserve the really fast turnaround testing for those instances at the moment, but it will change. Obviously, the improvement in the test availability has been really rapid. I mean, last week we didn't have a single test, and now the first tests are being ordered by Cottage Hospital to LabCorp. So it's very reassuring, and I think they're going to ramp up very rapidly.
And one of my previous questions was how many beds capable of putting someone in once we have a case, and what I heard is we have 47 negative pressure beds, but that we have the capability of expanding that in case there were more needed. What's the level of ability of expansion?
So we have 62 airborne infectious isolation rooms throughout our 5 hospitals. And I understand that we also had a question about how many ventilators we have, and we have 32 vents available. Plus, we also, in our Santa Barbara, at the health department, we also have caches of some ventilators available if needed.
And I would add to that with the construction and design of Cottage, we do have the potential to rapidly convert other rooms to negative pressure to add to our current tally. But if we do that, it then disrupts the airflow in the other rooms in that unit, so it would correspondingly potentially decrease our ability to care for general patients on the same ward. So we might have to commit entire wards to COVID-19 if that were the case, but there is some capacity to expand based on our engineering of those rooms.
May I add something else to this? We've also found out that it's possible to convert a regular room into a negative pressure room with fairly simple measures of like a suction pump and a very good quality HEPA filter. And the county clinic is actually looking into those options because we only have 2 negative pressure rooms at the Santa Barbara Healthcare Center in order to have just more availability and redundancy if that were to be needed.
Great, and I'll just also add that in response to some of the questions raised by the public over cruise ships, my personal opinion, of course, is that more people, more potential. So that it's nothing personal, but Supervisor Greg Hart and I are putting out this morning a letter to the General Steamship Corporation and the cruise ship lines, asking them, it's short, so I'll just read it. Due to the U.S. Department of State and the Center for Disease Control and Prevention recommendation against traveling by cruise ship in order to curb the spread of COVID-19, we join the City of Santa Barbara in requesting that your ships do not disembark passengers in Santa Barbara Harbor at this time. We ask that this request remain in effect until the CDC removes its recommendation against cruise ship travel. Your cooperation in this matter to ensure public health and safety of your guests, crew, and the residents of Santa Barbara is appreciated. We expect the City of Santa Barbara will be making a similar move today. And so I hope that reassures the public that while it is likely that there will be some transfer at some point, if there is not already, that we will not, that we will take steps to limit the exposure and potential of thousands of additional people.
I had some additional questions too. During the presentation, my staff actually received a question. People are very interested in this and watching on television. And Goleta School Board member Luz Reyes Martin asked over Facebook, how many people have been tested for COVID-19 in our county at this point?
Well, we have run 3 tests and they were all negative.
Okay, thank you. And then has public health contacted MTD about their plans and on the other public transit providers in the county about their plans to disinfect public transportation vehicles?
Yeah, our public health emergency preparedness program is currently working with Lyft. We also have just prepared a document that speaks to cleaning and disinfection, and right now our environmental health services program is reaching out to hospitals and hospitality organizations, and soon we will expand that to other like MTD and others. But we just completed our documentation that speaks to that sanitation and disinfection guidelines.
Okay. And is there planning going on to do outreach to homeless populations who have oftentimes compromised medical conditions and specifically maybe to nursing homes where that has already been a challenge in other communities?
Obviously, taking care of the homeless population in a time like this is extremely challenging. We do have gathered quite a lot of experience with our tuberculosis care in the homeless population, so there are very robust protocols in place with the shelters where they understand how to isolate and report cases directly to us immediately, and we've gone the extra mile. Sometimes, we have to put up people in a motel that has like a very good ventilation system under our supervision. So if that were to be necessary, we would perform in the same manner as we have been with other aerosol transmittable diseases.
Okay, thank you.
And with regard to, what was the other question? Homeless population in nursing homes.
Nursing
yes. We have 256 senior residential entities in our county. And our emergency services team is in very close contact with them. They have to prepare for power shutoffs, for evacuations, for outbreaks. So they are in constant preparation mode, and they actually practice evacuations and so forth on a regular basis. They're in a very close communication and have a very good endemic plan that they would essentially limit visitors from coming in. There are some challenges, but I think they are really well prepared.
Good, that's reassuring too. And then I think these couple questions are perhaps for Ms. Miyasato about county policy. What are we doing as an employer to support the employees in vulnerable populations who may prefer to work remotely or interested in protecting themselves through social distancing practices?
Thank you for the question, Chair Hart. So our Human Resource Director just sent something out this morning because there has not been community spread, as our public health officer has said. We are taking that seriously, but we're asking our employees if they are in one of the vulnerable populations who are more susceptible. Has been discussed that we want to be flexible with them, that they should be contacting their supervisors, and we should be making our attempts to accommodate their needs to telecommute or social distance within their workplace.
And have there been any changes to the policy regarding employee non-essential travel?
We are, again, leaving that up to the employees. If they do not feel comfortable traveling for a conference, many conferences have been canceled, but if they don't feel comfortable, that they should work with their supervisor about that. But again, we want to accommodate their needs and their concerns. So we are not going to be requiring anyone to do travel that's not essential if they don't feel comfortable doing so.
Okay, thank you. Are there any other questions from board members? We do have one person who'd like to speak on this item.
Yes, Chair Hart, members of the board, we did receive an additional request. So we have 2 requests to speak on the update this morning. We're going first with Jeff Bard, to be followed by Dr. Nason. Jeff?
Good morning. I'm sorry about the hat. I'm a rank and file cert volunteer. I'm here. I've been before this board, and I have presented a pandemic prevention plan that was ignored. I have been harshly critical of Dr. Pristowski, Doctors Without Walls, and most of all, the Freedom Warming Center and PATH. I was critical because they did not have adequate infection control protocols. DOS, don't feel reassured. Okay, the staff there, actually, I was quite vigorously suppressed and harassed. And I was ready to go into civil court. And I got a housing deal and blah, 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 and was blackmailed and pressured, and really undue influence and duress prevented me from going forward with the litigation. And this is all, I got it in writing that I was supposedly demoralizing because of all my talk about infectious disease, and all I wanted was protocols where you teach people, you cough into your elbow, and you wash your hands, and they didn't even have soap at Trinity Episcopal at the Warming Center. No soap in the bathroom. And I complained, and Jason just, oh, you need to just calm yourself, blah, 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 okay? No, this is not a time for calm. Now, the homeless are being scapegoated. And absolutely, that's improper. We need to protect from hate crimes, violence, and rhetoric that could lead to it. First, and Jason is a rock star at mobilizing youth. And I was very depressed to find out that only the old people are going to die off from this. And I thought, oh, well, okay. The kids will just all smoke weed and pass the joint, and we'll just all die. But then I realized, no, a lot of these kids are great kids in Isla Vista. They're wonderful kids. They want to help. I saw Asian American kids. I give them a thumbs up. These are good kids. And someone like Jason can get in there and rouse the troops and get the young people of this nation who don't have to be afraid of severe disease. And those are the assets. And I am looking to this young generation to really distinguish itself in the books of history by stepping up and bravely. And a lot of these kids are going to get sick for a little while, but they're going to go out there and they're going to save these old fogies like myself. So I have a lot of hope. And I hope that all my frenemies and the people I've criticized over the years will lay off. I'm not here for a gloat or a I told you so moment. But the reality is I have been harping on pandemic for years. I gave up. I figured, well, maybe I'll write a thriller novel about pandemic just sitting on the shelf. I don't have time to do the novel. This is reality. This is not a drill. This is not seasonal flu. I haven't met the new director. I have a way to explain what he meant when he compared this to seasonal flu. I don't have time. You have it in writing. It's very different than seasonal flu on many levels, and I'm sure he will concur. He's just trying to prevent panic. So let's be concerned but not complacent. Thank you very much for your time.
Thank you for your comments.
And our final speaker is Dr. Nason.
Members of the board, I'm Don Nason. The doctor is a science doctor. Don't ask me any medical questions. Speaking on the point of the spread of the COVID-19, I only have one input. Down on Casette Street is the Path Shelter, privately run, but I think managed by government. I have a friend who lives down there. About 4 days ago, he asked the question of them, what's being done about the spread of the COVID virus here, because a lot of vulnerable people live there. Most of them are dual diagnosis, mental and also drug addicted, but of course, living on the streets, they're also physically vulnerable. You live that way, you age before your time. The answer he received as to what was being done was nothing. I hope that with similar organizations like that that are perhaps not closely monitored, that this has changed, that all of them will be now more aware of taking measures of cleanliness and hygiene to avoid that being the situation, particularly among physically vulnerable populations like the unhoused neighbors that live all around us these days. Thank you.
Thank you for your comments, and I'm sure staff will reach out to Path and ask them to engage more aggressively. Well, this has been extremely helpful, I think, to the community to understand this issue better. The most important thing government and our healthcare providers can do to reassure people is to be transparent with this kind of information and to be putting out accurate, up-to-date information. And I appreciate you coming here today and sharing all the preparations that have been done and are being done to protect our community at this moment.
Chair Hart, I just want to take this opportunity to point out that we have a new public health information portal that should be coming up maybe late today, early tomorrow. And we're really excited about this because it is going to be much more user-friendly. It's going to have much more real-time information, and so we just want to promote that, and our information will be in Spanish, available in Spanish as well. So we encourage you, if you want any more current information, to please visit our new public health portal.
Thank you very much for that, Ms. Batson, and appreciate it being in Spanish so everybody in the community has access to that information. It's very important. Thank you again, Dr. Fisk, for coming, and all the folks from Cottage, and Dr. Henning and Ms. Batson, thank you for your presentation this morning.